Early identification of refractive error among pediatric patients helps to reduce the incidence of amblyopia, strabismus, and non-strabismic binocular vision anomaly. Our aim is to determine the correlation of occurrence of refractive error among siblings. The areas we focused were genetic factors and environmental factors. Background is when we consider school screening, 10% of the children noted to have refractive error. But whereas in the case of sibling screening, the study conducted in Pondicherry revealed 58.6% of siblings had ocular disorder. So the methodology includes a cross-sectional pilot study done in the age group of 0 to 15 years under the project named Systematic Pediatric Eye Care through Sibling Screening Strategy with the support of SEVA organization USA. We are thankful to them. And what we here did is children visiting pediatric ophthalmology with refractive error who had siblings were enrolled under this project, and the details were collected by the coordinator, and counseling of the parents to subject their sibling child were done. And inclusion criteria was children with refractive error fulfilling the following cycloplegic refraction were included. The criteria for less than 3 years of age was followed by, we followed American Association of Pediatric Ophthalmology guidelines revised in 2013. And for older children, we followed one of these criteria, that is more than minus 0.5 diopter sphere in myopia, and more than minus 1 diopter cylinder astigmatism, and more than plus 1 diopter for hypermetropia. Excluded, we have excluded those children primarily having refractive error due to accident or trauma, or those children who cannot come for follow-up. After complete ocular examination, refractive error was confirmed with the cycloplegic drops, and they were taken into account. And the parents were given questionnaire to fill up about the time of children time spent in near work, intermediate, and distant activity in the basis of hours per weekday, hours per weekend day, and the total hours per week was calculated, and based on that, average per day is derived. Statistical analysis included mean and standard deviation calculation, percentage analysis, and Sapir-Whorf test and Spearman rank correlation. Coming to the result, there were 289 probands who had one siblings and 32 probands who had two siblings, more than one sibling. And there were total of 321 probands and 353 siblings. And females were majority among them. And the right eye was compared between probands and siblings. So there were, for analysis, we were able to take only 301 patients because 15 had normal right eye refractive status and only refractive error in the left eye. Spherical equivalent, mean spherical equivalent among probands was minus 2 diopter and sibling was minus 0.5 diopter. When we consider the correlation of spherical equivalent among proband sibling, there was overall positive correlation which was statistically significant. When we break into gender-wise calculation, interestingly, same gender, brother, sister, showed statistically significant correlation, whereas brother, sister did not show such correlation. Few other studies have also reported sibling-sibling correlation for refractive error. The study by Young et al., where they have studied in terms of gender-wise, they have brought out that brother-brother correlation was lower than sister-sister correlation. A similar pattern was evident among a Singapore-based study also, but that was not statistically significant. This is scatter plot of our data where the first and second shows positive inclination, brother-brother and sister-sister data. Coming to anisometropia and sibling relationship correlation, even though there was minimal positive correlation, it was not statistically significant. Coming to the correlation of engagement in activities, near and outdoor activities, there was highly statistically significant correlation among probands and siblings. The similar result was observed by Guggenheim et al., and that is the amount of time spent by proband and sibling were almost same. And here is a study by Lee et al., where they conclude strong association of refractive error among siblings was more than the parent-child relationship. Here they hypothesized that siblings to have possible similar environmental influence than parent and child. So what we like to conclude is positive correlation of refractive error among same gender is observed in our study, which is statistically significant. And siblings share similar environmental factor, that is near and distant activities, which is again statistically significant. Hence, we conclude correlation of refractive error among siblings is not only influenced by genetic factor, but also by environmental factors. Limitation of the study is it is cross-sectional study. The amount of correlation, the percentage may increase in prospective study, which can be considered in future. Thank you.
There's one question I want to ask. Which refractive error did you see more in this myopia?
Myopia, madam, myopia.
And among the sisters and brother sisters, which one do you find more among this one? That correlation did you do?
Yeah, both were statistically almost near, close by. Both were statistically significant.
Similar.
Among these two, which you told one study, Singapore study has shown, but did you see any difference between these two?
Very, very close by values, madam. Just 0.26 and 0.25. Yeah, both were significant. Both showed high correlation.
So I really don't have a question because it's a pure epidemiological study. There's no question about the methodology. It was wonderful. I just had a suggestion that if the siblings can work out together, if an intervention is done on one sibling and not on other sibling, maybe that sibling can serve as a case as a control. I mean, that's just a suggestion.
Sir,
I understand there will be a lot of other things,
Yeah,
but this can help in the future.
Yes, sir. But in our study population, only 32 Probands had 2 siblings.
Yeah.
All other 298 had only 1 sibling.
Okay.
So the practical implication will be whenever you see a child with a refractive error, you should always call the sibling
Yes.
for the refractive.
Is there any correlation between the difference in the age, versus because two children with similar age or not much of gap will have similar environmental factors versus siblings who are
At a different age.
at a different age group?
Since it is a cross-sectional study, we didn't do that. We couldn't adjust for age.
Okay, thank you.
Thank you.